I'm very excited to introduce Dr. Alisha Morgan, who's going to talk to us about caring for the caregiver, really a practical guide for us as we think about, again, not just taking care of our patients, but that family unit as that becomes more and more important, both practically and as we are evaluated as clinicians. Dr. Morgan is board certified in internal medicine, geriatrics, hospice, and palliative medicine, is one of our attending physicians for palliative care at the Mayo Clinic in Rochester, as well as an associate medical director for Mayo Clinic Hospice. Delighted to have her here in Hawaii and talking to us about care for the caregiver. Dr. Morgan, thank you.
All right. Thank you to Dr. Strand and the other, my other colleagues from Mayo that have put this wonderful course together, and to Dr. Feely for asking me to talk today. So like Dr. Strand said, I'm going to talk a little bit about putting things together to care for the caregiver. It's a very broad topic, and as I'm sure you all know, there's individual needs depending on who we're caring for. And so it's also a very deeply personal and individualized thing, and some of you may have been caregivers or are caregivers at this time. So putting those things together and really kind of developing practical ways to assist our caregivers in practice. So I have no relevant financial relationships, not talking about any pharmaceutical things. We'll talk briefly about a few apps, and I don't have any financial disclosures to discuss about those. So really, as a broad objective, again, I'd like to kind of put things together so we have a toolbox to think about when we're talking about caring for our caregivers. A lot of the caregivers are not our patients per se. So how do we really recognize and identify our caregivers? How do we develop or put together resources for those caregivers? And how do we talk about strategies to improve resilience in those caregivers, I think are important things. So really identifying who they are. We'll talk some general demographics and costs of caregiving in general. We'll discuss some general assessments, some things to think about when we're talking or asking questions of our caregivers, and then thinking about some practical resources, and also some of those resilience strategies to alleviate caregiver stress. So we'll start with just kind of a general case. This might sound very familiar to a lot of you, but Mrs. S is a 75-year-old female. She's a primary caregiver for her chronically ill husband, who's 78. He has ischemic cardiomyopathy, end-stage heart failure, some dementia, had a prior stroke, has chronic diarrhea, so a lot of symptoms